Good afternoon. Today we will discuss about gallbladder stones, also known as cholelithiasis. So, definition: cholelithiasis is the presence of stones in the gallbladder. Epidemiology and demographics: gallstone disease can be found in 12% of the population. Out of these population, 2% to 3% population are treated with gallbladder removal surgeries each year. The incidence of gallbladder disease increases with age. Highest incidence is in the 5th and 6th decades. Predisposing factors for gallbladder stones are female sex, pregnancy, and age above 40 years of age, and family history of gallstones, obesity, ileal diseases, oral contraceptives, diabetes mellitus, and rapid weight loss, and estrogen replacement therapies. Patients with gallbladder stones have a 20% chances of developing biliary colic or its complications. And physical findings and clinical presentation. Physical presentation and physical examination is entirely normal unless the patient is having biliary colic. 80% of the gallbladder stones are asymptomatic, that is without any symptoms. The typical symptoms of obstruction of the cystic duct include intermittent severe cramping pain affecting the right upper quadrant. Pain occurs mostly at the night and may radiate to the back or right shoulder. It can last from a few minutes to few hours. Causes of gallbladder stones: the 70% of the gallbladder stones contains cholesterol and are usually associated with obesity, female sex, and diabetes mellitus. Mixed stones are the most common, that is 80%. Pure cholesterol stones account only for 10% of the stones and are the result of biliary supersaturation due to cholesterol secretion into the gallbladder and accelerated cholesterol nucleation and crystallization. 25% of the gallstones are pigment stones. Pigmented may be pigmented with bilirubin or calcium or any other organic materials. And these pigment stones associated with hemolysis and cirrhosis of the liver. These tend to be black pigmented stones and these are refractory to medical therapy. 50% of the mixed type stones are radio opaque. Differential diagnosis: peptic ulcer disease, gastroesophageal reflux disease, irritable bowel disease, pancreatitis, neoplasms, non-nuclear dyspepsia, inferior wall myocardial infarction, and hepatic abscess. Laboratory test: generally normal until and unless the patient has biliary obstruction. The If the patient has biliary obstruction, there are elevated alkaline phosphatase levels and bilirubin levels. Imaging studies: ultrasound of the gallbladder will detect small stones and biliary sludge. The presence of dilated gallbladder with thickened wall is suggestive of acute cholecystitis. A nuclear imaging scan, that is HIDS scan, can confirm the acute cholecystitis. And common bile duct stones can be detected non-invasively by magnetic resonance. And symptoms of gallbladder disease and its complications. So the symptoms are depend on presentation of the patient. See, if there is biliary colic, that is a pain around the biliary region, what could be the cause and what are the symptoms? Let's see. If there is biliary colic, the possible pathogenesis or pathology is transient gallbladder impactation at the cystic duct or ampulla of Vater. The symptoms are intermittent right upper quadrant pain associated with nausea or vomiting, pain in the epigastrium, or pain radiating to the right scapular tip, that is superior angle of the scapula. Episodes last for 30 minutes to hours within days or months between episodes. If there is acute cholecystitis, let's see the possible cause and symptom. If there is acute cholecystitis, the cause could be the inflammation of the gallbladder caused by obstruction of the cystic duct, may occur in the presence or absence of bacterial superinfection. The symptoms will be the patient appear ill and cannot take deep breaths. They have constant pain that lasts 30 to 60 minutes and worsen with movements. Persistent common bile duct impactation usually promotes vomiting. Physical examination demonstrates right upper quadrant tenderness with voluntary guarding and a positive Murphy sign. The positive Murphy sign. So, what is the positive Murphy sign? Arrest of inspiration during deep palpation over the gallbladder. The Murphy sign is next. What is the presentation? The presentation is emphysematous cholecystitis. So, what could be the cause? Infection with gas-producing bacteria such as E. coli or Clostridium perfringens and anaerobic streptococci. So, what are the symptoms? Symptoms are similar to those with the acute cholecystitis. Gas may be seen on abdominal plain films or CT. Male diabetics are most commonly affected. And another presenting symptom, chronic cholecystitis. What could be the cause? Persistent inflammation and fibrosis of the gallbladder with poor motor and absorption function. So, what are the symptoms? Patients are usually asymptomatic but may report multiple previous attacks of colic. Porcine gallbladder develops from chronic inflammation and progress to carcinoma, that is cancer. So, another symptom is gallbladder perforation. Sorry, another clinical presentation is gallbladder perforation. And let's see the what could be the cause and symptoms. Stones erode through an inflamed necrotic gallbladder wall. Stones may travel into the peritoneal cavity or cause adhesions between nearby structures. Bile peritonitis may develop more than half of the patient with gallbladder perforation. They have fever and palpable right upper quadrant mass. Mortality in these patients is 30%. 30%. So let's see what is the therapeutics and what are the management and treatment. So non-pharmacological therapy includes lifestyle changes. So it includes avoidance of the diet high in polyunsaturated fats, weight loss for obese patients, and laparoscopic. Sorry. A patient who are not appropriate candidates for surgery because of coexisting illness or patients who refuse surgery can be treated with oral bile salts. So these are the uncommon complications of gallstone disease. Emphysematous cholecystitis, cholecystoenteric fistula, and porcine gallbladder. These are the uncommon complications of gallstone disease.